Welcome to SNPLA Foster Program. We are so excited to have your help in saving the lives of thousands of neonatal kittens across the city of LA. At our nursery located in South Los Angeles, our goal is to rescue over 1,000 kittens annually. Neonatal kittens are kittens less than 8 weeks of age and are at the highest risk for euthanasia in the LA city shelter system, simply because shelters cannot provide the extra care and attention needed before they are ready to be put up for adoption. The purpose of our program is to help Los Angeles reach no-kill status by the end of 2018 through utilizing our nursery and, most importantly, the help from our fosters. Kitten season is the commonly used term to describe when cats are breeding. For cats, breeding is affected by the seasons, weather, and light cycles. Because Southern California is both very warm and close to the equator, we have a very long kitten season that stretches from March to November. This is one of the reasons we see so many kittens in need of rescue. A major contributing factor to the amount of kittens we see stems from unaltered pets that are either allowed to roam outside or have escaped their homes. Cats can go into heat as young as 4 months and can potentially have up to 6 or more kittens at a time. Altering your pets is crucial in order for us to diminish the amount of kittens we are seeing enter the shelters. By participating in our foster program, you are helping these kittens get ready for adoption into permanent homes. All of our kittens originate from one of the 6 LA city shelters and are either sent directly into a foster home through LA Animal Services or are transferred to a rescue partner and fostered out until they are ready for spay-neuter. As you can see, having foster homes is extremely important to their survival. Almost anyone can successfully foster through our program, but there are a few things to keep in mind before you get started. You will need some type of reliable transportation and be able to travel to our South LA location for kitten pickup and vaccines. You will need access to a phone and/or email. Most fosters utilize a bathroom or other small room to house their foster kittens. We recommend that whatever space you use has a door and is easy to clean. Not only are kittens sometimes messy, but it is important to disinfect this area after you have finished fostering or in between fostering different litters. You need to have enough time to provide the feeding, cleaning, and socializing necessary to help your foster kittens grow big and healthy. If you have pets, please make sure they are fully vaccinated and over 4 months of age. All approved medical, vaccines, spay-neuter, and basic foster starter kit will be provided by us. Since we are a nonprofit, we do ask if our fosters would be able to cover the expenses of any supplies needed after your starter kit runs out. When we are able to keep our foster supply expenses low, we are able to put that money into saving more kittens from the shelters. All foster volunteers must be 18 years or older or be accompanied by a parent or guardian in order to foster through our program. Our kitten nursery groups litters of kittens into different areas based on their age. Bottle babies, gruel babies, weaned kittens, moms and babies, and surgery-deferred kittens. These groups help us determine which type of care is needed for each kitten. Bottle babies are newborn to 3.5 weeks of age and need feeding around the clock. Kittens under 2 weeks need feedings every 2 to 3 hours, while our slightly older bottle babies will need to be fed every 3 to 4 hours. We also need to stimulate them before feeding, which involves using a cloth or cotton pad to make them urinate and defecate. These kittens are extremely fragile and are more susceptible to diseases. It is important to keep track of their weight and how much formula they drink at each feeding. They also need to be kept warm since they cannot regulate their temperature. We are able to lend you a heating pad for this purpose, which must be returned at the end of your foster activity. Although bottle babies do require more frequent care, the actual time it takes to feed is usually 5 to 10 minutes from start to finish. It may be hard work, but it can be very rewarding knowing that you gave these kittens the best shot at life. Kittens that are at least 3.5 weeks old and have teeth are called gruel babies. These kittens are in the process of transitioning from the bottle to gruel. Gruel is made by adding a little warm water to canned kitten food and blending it into a smooth pudding-like consistency. These kittens need feedings every 4 to 6 hours until they are reliably eating on their own. The transition process can be quick, or it may take a couple weeks, and it can sometimes be a messy process. At this age, they are starting to explore the litter box and may not need as much stimulating before feeding. Weaned kittens are at least 4 weeks in age and have completed the transitioning process and are eating well on their own. It is still important to keep an eye on how much they are eating. Weaned kittens should always have access to food and fresh water. This is a fun age. They will need some playtime and good socialization. Our goal is to get weaned kittens big enough, healthy enough, and social enough to be adopted quickly into a new home. We also get moms with their kittens into our nursery. Mom cats are a great way to experience young kittens without having to do as much of the work. As long as mom has plenty of food, a clean litter box, and a quiet environment, she will clean and care for the kittens until they are weaned. We typically keep moms with their kittens until the kittens are ready for spay and neuter and adoption. At that time, the mom will also get spayed and be placed up for adoption. Occasionally, we will have kittens in our care that are almost ready for adoption but have been deferred from spay-neuter surgery for reasons such as mild illness or they are underweight. When this is the case, we send them into a foster home to get a little bit older and bigger before we place them up for adoption. These kittens can be treated like weaned kittens and just need lots of love and attention. In general, you can foster any number of kittens you would like as long as they are from the same litter. We often get singletons into our nursery that do not come with any siblings. If that is the case, you may foster that single kitten by itself. Our organization does not pair up single kittens or place them into an existing litter as there is a higher risk for disease transmission. While we can divide larger litters into smaller groups for foster, our priority is to always empty kennel space in order to maximize the number of kittens we can rescue. Mom groups must always go to foster as an entire unit. We never split kittens from the moms unless there is a medical or behavioral need to do so. If you have resident cats at home, we strongly recommend that they are up to date on their FERCP and rabies vaccine and are over 4 months old prior to bringing home foster animals. We also recommend keeping fosters in a separate area away from your resident pets. Please note that the cats and kittens in our neonatal program have not been tested for feline leukemia or feline immunodeficiency virus, which are 2 viruses that any cat can get from having been outside and around cats. In the event that your resident cat becomes sick while you are fostering, you may bring your personal pet into one of our wellness clinics, but the exam, diagnosis, and treatment will be at the owner's expense. Depending on the condition of your pet, we cannot necessarily guarantee that we will be able to treat it. That being said, we have many foster volunteers with resident cats at home who have successfully fostered with us in this program. Now that you know what types of kittens you can foster, we would like to share some basic information on how to set up your home in preparation for fostering. The supplies we provide depend on the age of the kittens you are fostering. For bottle babies, we typically provide a bottle, KMR powdered formula, a gram scale, and a heating pad. Older kittens will receive wet canned food, dry food, and a litter box if needed. Please return unused or borrowed supplies at the end of your foster activity. Here is an example of how you can set up your foster area if you have limited space available. Many fosters will use a bathroom or spare room that has been kitten-proofed. As mentioned earlier, kittens need lots of food in order to grow big and strong. In general, kittens and mom cats can eat as much as they want. Kittens who eat excessively yet remain thin or bony, and kittens that have large bloated abdomens may require medical attention, as this could indicate a parasitic infection. For GRUEL kittens and older, always provide clean, fresh water along with dry food and feed canned food or GRUEL as directed. If any of your foster kittens are having any trouble eating and are losing weight, please let us know, as they may require medical attention. Very young kittens cannot regulate their body temperatures, so until they are weaned, they need to be kept in a warm environment. Cold kittens are at higher risk for hypothermia and should never be fed until they have been safely warmed up. Using an electric heating pad on low or a microwavable snuggle disc are often used for young kittens who do not have a mom to help keep them at the right temperature. Always make sure there is enough room for kittens to move off of the heat source if they become too warm. Most kittens do not need bathing even if they get a little messy. Using a baby wipe or a warm, damp towel to remove food, litter, and dirt is the best way to keep them clean. If your foster kittens are particularly messy or dirty, you can give them a bath, only if they are in good health. Sick kittens should only be spot cleaned or cleaned with a wipe. To give a kitten a bath, you must use baby shampoo, pet shampoo, or an unscented dish soap. Use warm water and never get water on the head, ears, nose, or mouth. Afterwards, kittens need to be completely dried with a hairdryer on low. Wet kittens can get cold quickly and are at higher risk to get hypothermia, so only reserve baths for kittens who really need it. Spending time in foster home is the best way for kittens to receive much needed socialization. Friendly, well-socialized kittens often get adopted quickly and transition well into their new homes. Giving kittens at least 15 minutes of interactive playtime twice daily can help them build important skills. Kittens love to play with toys, but luckily you can turn almost anything in your home into a toy that they'll enjoy. Crunched up pieces of paper, empty water bottles, and thick ribbon can all make a great free kitten toy. Never give kittens yarn or string to play with, as these can accidentally be swallowed and cause a major medical problem. Also make sure kittens have plenty of rest time between playing so that they don't burn too many calories. We all like active kittens, but they must be able to eat enough to make up for all the running around. During cuddle time, you can massage your kitten's toes, ears, and tail so they get used to being touched all over. This will make it easier to handle them as they get older. If your foster kittens need any extra behavior support, please reach out to us so we can provide information on how to successfully socialize hissy, shy, or mouthy kittens. As a foster volunteer, we expect you to follow all instructions and guidelines as communicated with you by a member of our foster department team. Our foster program uses an appointment-based system for picking up animals, bringing them in for vaccines or vet appointments, and returning foster animals into our care. Please note that you must have an appointment for vet visits, animal pickup, and drop-off, but vaccines can be done any day we are open during normal business hours. Beginning at 4 weeks of age, kittens need to come in for a vaccine, deworming, flea treatment, and weight check every 2 weeks, so we can expect to see you every couple weeks until your foster kittens are ready for spay-neuter. If your foster kittens are sick or need vet care, you may need to come in more often. Appointments will be made through a member of our foster department. It is important to note that cats and kittens entering our neonatal program are at high risk for contracting common shelter illnesses, as they do not have a fully developed immune system. Common illnesses we see in a shelter environment include upper respiratory infections similar to the common cold, bacterial and viral infections that may cause diarrhea or vomiting, parasites that include fleas, worms, and mites, and occasionally more serious viral illnesses such as calicivirus and panleukopenia, which may require more extensive medical care. All cats and kittens are treated for parasites upon arrival to our kitten nursery, and we monitor our kittens closely for signs of illness. Once they're in your home, it's important to keep track of your foster animal's appetite, energy level, and weight, as a drop in any of these could indicate a medical concern. All medical needs for your foster animal will be provided by our veterinary team. Please note that we will not be able to reimburse you for any medical treatments or costs obtained by any organization or veterinary hospital outside of our veterinary team. Another common ailment we see in neonatal kittens is fading kitten syndrome, which is a set of symptoms associated with a failure to thrive kitten. Without immediate attention, fading kitten syndrome can be fatal. Symptoms of fading kitten include extreme lethargy, or their body has gone limp, cold body temperature, open mouth breathing, loss of appetite, loss of muscle in the body and face, odd vocalization or cries of pain, dehydration, and weight loss. If you notice your foster kitten with any of these symptoms, notify your foster department and begin our fading kitten protocol. Make sure that your kitten is warm. You can burrito them with a blanket and wrap a heating pad around it on the low setting. Secondly, administer Caro syrup to their gums or tongue and be engaged with your foster kitty. It can sometimes take hours for them to come out of it. Please be aware that even with the utmost love and attention and perfect treatment of this condition, some of them still will not make it. Know that any kitten you've taken care of was given a second chance at life because of you. The survival rate with our care far surpasses their survival rate in nature. If you think your foster needs to see a veterinarian, you have a few options. First, you may ask questions or send photos of what you're observing to the foster department. This is a great option if you're only seeing minor symptoms and are not sure if a vet visit is needed. Secondly, if the foster department does believe your foster needs to be seen by a veterinarian, they will set up an appointment for you. Lastly, if your foster kitten needs immediate medical attention and our clinic is closed, please call 818-473-5451 and leave a message, and a staff member will return your call within 15 minutes. Treating illness in kittens is often a simple task involving once or twice daily medication for a few days to a couple weeks. Be sure to follow all of the instructions given to you by our veterinary team and let us know if you have any questions. Our goal is to find safe, loving, permanent homes for all of our animals. For kittens, they become available for adoption as soon as they are spayed or neutered. This happens approximately at 6 to 8 weeks of age, as long as they weigh a minimum of 1.5 to 2 pounds. All kittens must be spayed or neutered prior to being adopted. If you or someone you know are interested in adopting one or more of your foster kittens, you must contact someone from the foster department prior to scheduling their spay or neuter surgery. Our foster volunteers will often find homes for their foster animals prior to adoption. Although it is not required, we welcome you finding homes for your foster animals within your network of friends, family, neighborhood, and coworkers. Anyone who's interested in adopting one or more kittens, including yourself, must first fulfill our basic adoption requirements, which requires filling out an adoption agreement and reviewing the paperwork with a member of our adoptions team. Until the adoption process is complete, you may not transfer the care of your foster kittens to anyone else without written permission from a foster coordinator. When you pick up your foster kittens, we will give you an estimate of how much time they will need to be in a foster home before they are ready for adoption. However, we do understand that plans change and emergencies occur. If you are unable to keep your foster kittens for the full amount of time originally agreed upon, please let us know as soon as possible. We are often able to transfer them into another foster home. Now that you know who you can foster and what we expect from you as a foster volunteer, you're almost ready to get started. If you haven't already, fill out our foster questionnaire on snpla.org/foster, and a member from the foster department will get back to you within 24 to 48 hours. If you have already filled out the questionnaire and have been contacted, then you are ready to start fostering. If you have any further questions or need assistance, please text or call 818-473-5451. Thank you for taking the time to watch this presentation. We look forward to saving lives with you soon.